Hello everyone, welcome to another episode of Data to Decisions. I'm pleased to have Shwen Gwee here today. Shwen is a pioneer in digital health and innovation. He was most recently the head of global digital strategy at Bristol Myers Squibb, where he led digital strategy and innovation across business functions for the enterprise. A pleasure to have you here, Shwen.
Thanks, Ganes. It's really good to be here. I appreciate you inviting me onto the show.
Absolutely. Shwen, you recently spoke about the latest trends in digital health at an event. Can you share the top 3 megatrends you see in this space?
Sure. That's a really interesting question because in the world of digital, things are changing all the time. But I think what you're starting to see, especially in the healthcare industry, that's starting to impact the different areas of healthcare, including pharma. There's 3 main mega trends that I think are really starting to come into the light of really having that impact. And a lot of them are actually underpinned by AI, machine learning, and automation overall. So the first mega trend that I'm seeing is really how data and analytics are transforming R&D. And that means everything from how drug discovery is being done and how we can start to accelerate the process of, finding the right targets and accelerating cycle times, as well as how we're starting to leverage data and artificial intelligence and insights to really our probability of success. Now, the second mega trend is around quality care and how it's starting to shift much closer to patients. So with the rise of digital health and remote patient monitoring tools, and the fact that everybody is either carrying a smartphone or wearing a smartwatch, we're starting to be able to shift care away from the traditional centers of excellence. So whether that's an academic center or a clinic or hospital, we're starting to be able to shift some of the stuff that we used to have to always go into the clinic for to the home instead. And then the last one I wanted to touch on was just how the cutting edge is becoming mainstream. So how the big players and big tech such as Amazon and Google and Verily and so on are starting to really create the standard by which a person experiences digital, and how are we starting to bring that into healthcare? We're starting to build our digital health devices in accordance with how people live their lives. So it's very much the other way around. It's not trying to make them change and do something different, but how do we integrate what we do so that we're able to start to collect data and help drive better outcomes for the patient in their daily living from home, and really start to provide for their needs based on their lifestyle and their workflow.
Yep. Looks like a lot happening in this space. All of these are very interesting. If I were to look at the 3 trends, the way I would summarize based on all of this is, you talked about R&D, drug discovery, and you talked about drug development, decentralization, patients, wearables, and so on. And third, you talked about the cutting edge going mainstream with the new players and broadly digital health. Can you talk a little bit more about digital health, Shwen, and where it is today and what we can expect in the future?
So I think in general, when we think about digital health, we're talking about everything that is a digital platform that is targeted for a health sort of theme, right? Whether it's health, whether it's wellness, it's everything that falls under the bucket of a digital platform that treats, or a digital solution that is for healthcare. Now, within digital health, you've got certain subsets. And so, for example, the subset of digital medicine is a digital health product or solution that actually has clinical evidence, right? That it shows that it actually works. And then even within digital medicines, you've got another subset called digital therapeutics. And that one, you've got even deeper subsets within them, including prescription digital therapeutics, which requires a prescription. But in general, digital therapeutics themselves are digital that actually have not only got evidence, but they actually are shown to drive better outcomes for the end user. And so you can see it gets pretty tricky when you start digging down deeper. But in general, digital health, I think, is that broad topic that captures everything that fits within health and wellness that is actually a digital solution.
Okay, I think so. The iPad or a watch or our latest Android phone can help with our health, can be a prescription. Is that what you're saying?
Yeah, I mean, at the end, these are all just devices and channels by which the actual solution can be delivered, right? So I think they're just the device that enables these things to be used and appropriately. But at the end of the day, it's the solution itself, the platform, the product that leverages these devices, whether they actually drive the right outcomes is the key, right? Do they actually provide a therapeutic benefit? Do they actually provide an intervention that changes your behavior, which is better for your outcomes, and so on and so forth? So how they're helping you in your healthcare and your lifestyle to be able to change that to make you healthier is really the key.
Okay, yep, that makes total sense. A lot of new trends we are talking about, and one unmissable trend is Web3 or metaverse. Right? It's hot right now. Everyone seems to be talking about it. I don't know how many of these actually would translate into real life applications. I've been hearing about a lot of these in the pharma healthcare space as well. Can you talk about where that is today, and can you share any examples?
Sure. I think, all the trends that we're looking at right now, that's probably one of the most nascent trends, right? And Web3 includes things like metaverse, NFTs, non-fungible tokens, blockchain enabled sort of platforms, including things like DAOs or decentralized autonomous organizations. So that's the broad scope of where Web3 sort of plays. And I would say that we're only in, version one, not even 1.0. I think we're only in, the first beta right now. It's 0.1 or 0.2. And even in the consumer world, we're still trying to figure out where it's really the utility and the value is really coming into play. But it is something that a lot of people are talking about. Having said that, in healthcare, you are starting to see VR and AR used quite a lot for things like pain reduction, and it's shown very and remarkable results and driving really positive outcomes and reducing pain by a significant amount, almost to the point where you might not need a pharmacological intervention because you can use these types of platforms. So that's an interesting part of that. And then finally, I think if we want to talk about DAOs, that's something that's really interesting to me because we're starting to see DAOs as these democratizing the ability to bring a group together. So it's basically like a decentralized and democratized community that basically has a financial investment in something, for example, or at least has a financial structure. And you could maybe call those advocacy groups in the past or co-ops, but imagine the application of that when the entire community is given, let's say, voting rights, so to speak, to be able to make decisions for that community. And that's essentially the role of the DAO. And then if they've got a financial structure associated with it, what are they investing in is the question. And if you apply that to healthcare, is that something that could drive where investments go in healthcare? So I think that's really interesting as well.
Yeah. In the current economic situation, I think the markets aren't very kind to some of the digital assets and investments, but it's probably based on what you explained. It's clear that they are here to stay. And then in the longer run, we will find more practical applications and they will be integrated as part of healthcare. Now, we talked about a lot of trends. Trend spotting is one thing, but applying it and solving some challenges and scaling it on the ground is entirely another thing. Done both in your roles, Shwen. So we hear a lot when I talk to executives in pharma organizations, there are challenges with digital initiatives succeeding and they don't deliver the intended outcomes. What's your advice to executives to succeed when they're applying, say, such cutting edge digital initiatives?
Yeah, I think there's several parts to that question which need to be addressed. And part of it is just due to the inherent nature of how most healthcare companies have, I'd say, big corporate organizations in healthcare have been designed, which is really to be a big engine to do what they do well. So in the case of pharma, they're really good at drug manufacturing and they've developed the process to go from discovery all the way to commercialization and delivery. So the challenge comes in when you start to work with some of these novel startups that bring in solutions that haven't been fully proven out yet. The first part, though, I think that most companies need to think about is identifying the key business challenge that you want to really engage an external solution partner for. And to me, based on my experience, that's really the most important, because if you're not defining your business problem well, then you're going out and finding a solution that might not actually address the right problem. So digging into the actual problem statement, really identifying and defining what the challenge is key to understanding what solution you need to go out and look for. The second part to that is once you go out and start finding the right solutions, don't just be attracted to the first one you see, but understand the landscape and understand, how it plays in the ecosystem. And then once you find the right person, you bring them in, are you adjusting some of your internal processes and are you adjusting your risk so that you can work with them in a way that's not the traditional sort of contractual RFP to implementation process, but really take much more of a experimentation process. So how are you structuring it so that the contracting stage doesn't take 3, 6, 9 months in order for that contract to go through and require the startup to spend a lot of time and money with an external legal counsel in order to get that contract done. Because at the end of the day, if you're actually doing just an experiment, do you really need such a foolproof contract in order to get the experiment done? The second thing is, can you create things like sandboxes or stage-gated approaches to experimentation so that you're testing the hypothesis, because you don't know if the solution is actually going to work. It's not like building a website. There's no like standard way of doing it and you know what you're going to get at the end of the day. You're still testing a hypothesis. So how are you creating that space and that environment to actually do an experiment for this hypothesis? And then if it works, then how do you put more investment, time, and maybe extend the contract a little further to actually start to build out a pilot, and then from there go into implementation? So how are you doing that in a way that is much more structured, much more rapid and agile way that allows you to iterate along the way rather than just say, this is the final product I want and I need you to build that, and if it takes you 2 years and $1 million, then go for it. But how are you going to know if it's going to work if you're not testing it along the way?
Yep, I love it. I think the approach you outlined can be applied not just for pharma digital health innovations, but I think pretty much anywhere you're using technology. So I think it's worth summarizing. You talked about identifying the business challenge, understanding the landscape of offerings, providers, and choosing the right one. Third, bringing them in, integrating them with your organizational processes. And then fourth was experimentation, sandbox, agile methodologies, and testing it out. And then 5 is expand and productionizing it and scaling it. Yeah.
And Ganes, sorry, one last thing I'll just add is if you really understand your business problem that it's going to solve, that should also allow you to give you the outcomes that it should be driving. And therefore, you can sort of start to put around the outcomes that you're expecting and the value drivers and what is the actual business value it's going to create, right? So it's all related to the initial question, which is around what is the problem you're trying to solve.
Okay, perfect. I think a lot of useful resources there. And you also are part of several events. You attend and you speak at events. Can you recommend a few events for people looking to learn about the latest trends in the space and meet innovators?
Sure. So I am not a believer of just sticking to one vertical type, like going to events that only serve one vertical. So just healthcare or just pharma, right? I do go to some of those, but I try to spread it out so that I also go to events which are cross industry because I feel there's a lot of learnings you can get from many different areas. And so one of the ones that I've been going to for the last 12 years now is South by Southwest, which is in Austin every March. And that is one which is across different industries. And they have a health track there, which I've been involved with for the last 10 years or so and run events there for the last 8 to 10 years. Another one would be for those that are into advertising and marketing, certainly the Cannes Lions Festival, which is actually coming up very soon in June. That one is a great event for those in media and advertising and the creative space overall, but really tackling things around trends in commercial innovation, for example. And then another one that I like to go to is the health HLTH, which is one that really looks across the healthcare industry, not just one particular part of the industry like pharma, but also, pharma, payers, providers, health systems, and so on, bring them together to talk about innovation and trends in health. So that's a really interesting one. That's usually in October, November. And then another one for clinical innovation that I like is a CNS Summit. And CNS stands for Collaborating for Novel Solutions, not what you think it is. It's not focused on one therapeutic area, but it's actually based on the trends, especially around clinical development and clinical trials and so on. But overall, it's an innovation event with really great thought leaders and speakers and just a really tight community of people who are very much about sharing and learning from each other.
Yep, pretty interesting. Yep. Thank you. And I think it's been a very interesting conversation, Shwen. So great insights. Okay. How can our listeners get in touch with you and stay updated about your work?
Sure, thanks. I think the easiest and best way is probably to go through LinkedIn, right? And that's very easy to find. My profile is just LinkedIn/in/Shwen, SHWEN, my name. And so please drop me a note there and let me know where you heard or saw me, and happy to connect there.
So it was a great conversation. I really enjoyed it, Shwen. Thanks again for being on the show.
Thank you, Ganes. It's been a pleasure, and I wish you all the best.